Hello friends. Today we are going to discuss about group skills training in dialectical behavioral therapy. I am Dr. Suresh Badadmat, Professor of Psychiatry, working at NIMANS, Bangalore. Before I start my presentation, I would like to place this disclaimer. This presentation is for academic and training purpose only. For clinical opinion, please do contact a psychiatrist. Conflict of interest? None. In this video, I am going to discuss about group skills training in dialectical behavioral therapy and what are the components which we need to train a client in dialectical behavioral therapy. This video is targeted to psychiatrists, doctors, nurses, mental health professionals, psychotherapists, and counselors. As you know, dialectical behavioral therapy has four important components: individual therapy, group skills training, DBT consultation team, and telephone support. In this video, I'm going to discuss about the group skills training, very important component of dialectical behavioral therapy. Let's discuss about group skills training in dialectical behavioral therapy. We are all humans. We are made up of cognitions, emotions, behaviors, sensation, and experiences. In few clients, especially borderline personality disorder, clients who have suicidal ideas, depression, anxiety, eating disorders, in such clients, emotional dysregulation is at the important dysfunction noted. Further, genetic vulnerability and environmental invalidation plays a crucial role in developmental of personality disorders and also various mental illnesses. So, group skills training becomes an important component for any kind of therapy. It is not just known. By knowing cognition, emotions, and behavior, it is not enough. Once you are aware of these issues, you need to get trained in dealing those situations. For example, you may know how to play an instrument like drums, but unless you practice that skill, how to beat the drums, then you will not learn at all. Knowing is different and completely from how to practice it and performing it. Hence, in the four walls in individual therapy, you may teach a skill, but those skills need to be used in real life. That is called as generalization of the skills. The group skills training is the first step. We are dealing with adults having their emotional dysregulation and interpersonal skill deficits. Here, group skill training is chosen because individual sessions has its own limitations. For example, in individual sessions, invariably it will be didactic lecture or else more of discussion. Training of skills do not occur. Whereas in group skills training, which the group, which will be either homogeneous or heterogeneous, the client comes to know there are many people like him who are going through difficult scenario. There will be vicarious learning. The client may learn from other clients how to deal the situation. And that situation of group itself becomes a real life setting because they need to interact each other during group skill training. And that itself will give a platform for providing training and also in vivo exposure. Let's discuss about group skills training team. Here, the team will meet along with the clients one session per week. Each session will last 2 to 3 hours, and each group will have 6 to 8 clients, not more than that. And each group will be managed by one primary therapist and one co-therapist. The reason to have this one primary therapist and one co-therapist invariably running this therapy for 2 to 3 hours, and especially when there are clients of 6 to 8 who may be having borderline personality disorder, who may have deliberate self-harm, depressive symptoms, it will be highly demanding. Keeping attention and concentration, providing support, to the clients becomes highly demanding. Hence, there is a need for one co-therapist to support the primary therapist. These sessions last every week over a period of 1 year. But however, the skill training occurs in two settings, that is, two cycles, 6 months once, over a period of 1 year. This team consists of psychiatrists, psychotherapists, counselors, case managers, social workers, and psychiatric nurses. And all these people need to be trained in providing skills. That means they need to undergo themselves the skill training. At the same time, the attitude of the skill trainer should be appropriate towards DBT objectives. That means unconditional acceptance of the client should be there. These skill trainers will never comment about the behaviors of these clients because in a group settings, it becomes very challenging. Hence, these trainers need to be trained appropriately. They need to be trained in behavioral aspects such as behavioral analysis, solutions, contingency management, exposure procedures, interpersonal skills, mindfulness, empathy, basics of skill handling, handling conflicts in a team, group dynamics, and so forth. That means they need to learn about learning skills and behavioral management. Further, they need to learn about the dialectical behavioral therapy strategies, such as dialectical strategies, validation, problem solving strategies, communication, reciprocal communication, irreverent communication, consultation to the patient, suicide prevention, and also environmental intervention strategies need to be learned by this team. Let's understand what are those skill modules which the training team should learn and the skills transference should occur. There are four important skills which need to be learned. One is mindfulness skill, interpersonal effectiveness, emotional regulation, and distress tolerance. So these four skills need to be learned by the team, and once they have learned, they need to transfer those skills to the clients. So these are the four important skills which need to be given to the client in the group skills training. So let's understand how the planning and the curriculum transfer occurs. If you look at this chart, this is divided into two 6 months training, first 6 months and second 6 months. The curriculum will repeat twice in a year. Here, orientation and mindfulness occurs over a period of 2 weeks, that is 2 sessions, that is 4 to 6 hours. Second one will be interpersonal effective module. Here, it is a 5 weeks module. Orientation again, you will be shifting to mindfulness module, again for 2 weeks. Emotional regulation module, that will be for 7 weeks. Orientation plus mindfulness module, and finally, distress tolerance module. Once you have finished 6 months of training, skills training, again, you will repeat for the next 6 months. That means twice it will be repeated over a period of 1 year. Here, it is called as spaced intervention. First 6 months and second 6 months, same module will be run. Here, you need to finalize the skills which need to be transferred to the clients. Decide the duration. And each skill training session should be accompanied with handouts and worksheets. You may need to give manuals also. You need to choose the spaced sessions. That means 6 months, one set will be done, another 6 months, it will be repeated. It is very important to make it clear during the orientation of the skills training. That means here, the skills enhancement will occur to the participants. That means you are empowering the client. You need to tell that the focus is not to change other people's behavior. The focus is in the skill training is to enhance the skill of the client. Here, the client should not expect that the therapist will help to modify the behavior of the family members, behavior of his boyfriend or husband or the wife. Those things will not be expected here. That has to be clearly told. Here, the skill training occurs or the client, and the client need to understand he will enhance his skills. However, in certain situation, you may not be able to do group skill training. Although the DBT clearly says group skills training is the best. However, in certain situation, you may need to consider individual skill training also. Individual skill training will be done with a one client who is not suited for group therapy, who is highly suicidal or maybe violent, severe symptoms, emotional dysregulation, or else a VIP patient who does not want to mingle with other clients, wherever the confidentiality is stake, and you are the only one therapist are available, or the clients are very less. In such a scenario, you may need to consider only individual group skill training. But however, dialectical behavioral therapy, Marsha Linehan clearly said that group skill training is the best. Now the question is, should we have massed or a spaced training? Should we do a single training over a period of 1 year, or else we should do 6 months once, twice training? Of course, you need to consider group therapy, because group therapy is commonality. Sharing of the problems will be there, learning from each other will be there, transference can be handled easily, and also interacting with each other will provide effective vicarious learning. You need to consider whether we should have open group or closed group. That means in open group means the client can move from one group to another group. For example, if the client comes in the morning for few sessions and later he says he is unable to come in the morning and he wants to shift to the afternoon, that is open group. Whereas in DBT, it is advisable to consider closed group. That means the client need to learn certain skills in the same group. Should we consider heterogeneous group or a homogeneous group? Heterogeneous means different disorders, OCD, eating disorder, borderline personality disorder. All disorders are clubbed together in a group. That is heterogeneous. Homogeneous group is basically group of borderline patients, disorders patients are considered for the group. That is called as homogeneous group. Invariably in DBT, mix and match works. But however, if you are dealing sometimes in borderline personality disorders, you may consider a single homogeneous group. DBT skills training now, we need to, as I mentioned, 4 important skills. That 4 important skills which need to be transferred are mindfulness, emotional regulation, distress tolerance or crisis management, and interpersonal relationships. That means 4 important skills need to be trained. Now we will move to the mindfulness skills which need to be trained. What is mindfulness? Mindfulness means doing one thing at a time in the present moment with full attention and acceptance. Here, mindfulness means you are giving complete attention and acceptance in the situation in the present moment. That is called as mindfulness. It has 2 parts. Please understand, although it looks very simple, but very difficult to practice and learn. In this 2 part, first one is awareness of the present. That means staying in the present moment. Not only that, accepting the experience which is going through. That means you'll accept your thoughts, behaviors, emotions. But at the same time, whenever there is a wandering of the thoughts occurs, you gently will bring back that mind in the present moment, and you will have non-judgmental attitude towards your thoughts. That is awareness, acceptance, and gently bringing back to the current moment. That's called as mindfulness. Here, you need to convince the client that mindfulness is helpful. You need to tell them mindfulness is helpful whenever the client has painful emotions, whenever the client has uncontrollable thoughts, and whenever the person requires to modify his behavior, to improve the concentration and attention, to improve quality of life. That need to be emphasized. Once you are able to sell that mindfulness works, and definitely it will work, because mindfulness is based upon Buddhism's Zen practices. And they do it over a period of years and they become very calm and cool. Here, mindfulness, the same principle is used. Here, you need to practice mindfulness. How to do that? Choose any activity. It may be just breathing. You need to focus on the breathing, that is the activity. Notice whenever the attention moves away from the breathing, gently bring back. That is what is called as mindfulness. For example, The best example which is given in mindfulness is jumping monkey or a monkey mind. The monkey does not stay in one place. It will be constantly in the move, jumping from one tree to another, in constant moving, impulsivity, and running all over the place. Now, you need to teach this monkey how to be in the present moment, having attention and concentration and focusing the activity at hand. That is mindfulness. Or else, the best another example is training the dog. The dog, a small puppy, needs to be trained. Whenever you say sit, it needs to sit. Whenever you say get up, it should be able to stand. During the initial part of the training, the dog will not be able to understand what the instructions are given. Over a period of time, by doing behavioral therapy with the dog, by reinforcement mechanism, the dog will learn. Here also in mindfulness therapy, you need to train the dog, that is mind, at your will so that it will start listening to you. If you are able to make your mind under your control, that means you are able to deal your future and present in your hand. That means the mindfulness you have achieved. Here in mindfulness, there may be formal mindful practice, informal mindful practice, or combination of both. What is formal? Formal means you have a particular time, maybe early morning from 6 o'clock to 7 o'clock, I will do mindful practice. That means it is a formal training, 1 hour or 30 minutes every day. Informal means whenever you get time, you do this practice. Suppose you are traveling in the car, especially you are the passenger, you are not a driver. If you are sitting, you do mindfulness practice inside the car. Sometimes combination of both formal and informal. However, avoid informal in the beginning. The reason being, imagine if you are traveling at the same time, if you have to drive, you cannot do informal access here because you are focusing on the road. At the same time, you need to drive and also do mindfulness. It is simply impossible. So, in such a scenario, please avoid informal in the initial practice. Even don't do two tasks at a time. For mindfulness, you should be empty and you should be able to focus on doing mindfulness. What are the different types of simple activity which can be done? Counting the breath, or else focusing on the breath. The way you inspire, you do the inspiration and expiration. As you focus, just think you are taking good oxygen into your body and slowly you are leaving carbon dioxide outside the body. Or else mindful eating. That means just observing the food, the color, the texture, the aroma, and the taste. You will be in the present moment enjoying the food rather than gulping the food. Mindfulness walking, mindfulness dancing, listening, watching, and so forth. Various activities can be done in mindfulness. But however, certain challenges are there in mindfulness. If you do not have time, you are in a constant move, you will not be able to do. Whenever you attempt mindfulness, you have anxiety attacks, panic attacks, you have restlessness, you are unable to hold your thoughts, poor concentration. Whenever you do mindfulness, you go into sleep, or you are in a constant worry. Whenever you attempt, you will be starting thinking about what will happen tomorrow, what will happen to my child, what will happen to my father. That kind of constant worry is there, or else procrastination. I will do mindfulness tomorrow or day after tomorrow. So, that kind of procrastination also has been found to be challenges in mindfulness practice. But, however, you need to understand the first and the foremost in mindfulness is mental noting. That means observing and describing the moment. That means moment by moment, you will observe, notice it, describe the experience, and you need to be non judgmental doing this. That means very important is whenever you are observing any event, whenever you are noticing it, whenever you are describe, you will be an impartial spectator to it. You will be just observing it. That means you may have the experiences, that internal experiences and external experience. For example, When you are having mindfulness breathing, you have internal experiences. That internal experience may be thoughts, emotions, sensations. They are all internal experience. External experiences are from the environment, that is outside the body. Maybe somebody walking around, or there is a music playing around. So those, you need to become impartial spectator to that. You will not get carried away by that. That means you are observing and describing in the present moment in a non-judgmental attitude. That is the very essential component of mindfulness. What is judgmental? Judgmental means assessing or evaluation of something or someone, either good or bad. Whenever you do judgment, that is judgment about self, others, and event. When you say the judgment is good, you feel happy. You feel there are good thoughts. Whenever you have a bad judgment about yourself, you feel self critical. You will feel low. You will feel depressed. You feel anxious. Whenever you judge another person, he is bad, you feel sad. You say that fellow is irritating, you also get irritated. That means you need to have a non judgmental attitude. Whenever you do judgment about any person or in any event, you will get associated emotions. So you need to learn this impartial spectator in a non judgmental attitude. The best example is tornado. Imagine you are walking down the street, you find a tornado in front of you, maybe around 100 meters in front of you. Now, if you get into the tornado, it will suck you into this tornado. You will be thrown apart in this emotional turmoil. Here, you need to stand away from the tornado and just watch it. That is considered as impartial spectator. You will observe your thoughts, your emotions, non judgmentally, accepting it, and not getting carried away. That is impartial spectator. During this impartial spectator, you need to understand there are two types of emotions: primary emotions and secondary emotions. Emotions in response to the interpretation of an event. There is an event which has occurred, you get a primary emotion. What is secondary emotion? The way you feel about the primary emotion is secondary emotion. I'll give an example. As you go to your office, you are late by 5 minutes. Your boss will yell at you, and immediately to the reaction, you become angry. That is primary emotion. After some time, when you go back to your seat and start thinking about it, yes, my boss became angry and shouted at me. I also became angry. What could I do? I did not do anything. Although I am angry, but I could not do anything, and you get depressed. That depression is secondary emotion. That is, emotion in response to the interpretation of the event is primary emotion. And for the primary emotions, how do you feel after? That is secondary emotion. How to understand this? Emotions and judgment, because they go hand in hand. Whenever there is an event, judge for emotions. And what is the judgment about this? And also, emotions after the judgment and outcome. Let me give an example. As you go inside the kitchen, you find the lunch box. The lunch box which was supposed to given to your son, which he is supposed to carry to the school, but you have forgotten that. And suddenly you realize your child has gone to the school without lunch box. You get frustrated. You feel that you are a useless mother. And now that useless mother is the judgment. As soon as you feel that means useless mother, you get sad. Now, the emotion as you saw the lunchbox frustrated is the primary emotion. And after thinking that I'm a useless mother and getting frustrated and becoming sad, that is a secondary emotion is sadness. The outcome is depression. If you are able to make this chart and you are able to do it over a period of time, you will be knowing how is your judgment, whether it is positive judgment or a negative judgment, or else good judgment or bad judgment, you can consider it. The more you do this, you will be able to understand how you are interpreting the event, how your primary emotions and secondary emotions are going hand in hand. Now, let's move into the crisis management, also considered as distress tolerance skill. You need to teach the survival of the crisis or else distress tolerance skills. What do you mean by distress? Distress means suffering that affects the mind or the body. Crisis is a time of intense difficulty or danger. This is common in borderline personality disorder, in patients with emotional dysregulation, or patients having deliberate self harm. In every event, there are three important skills, or what we call it as reasoning or the state of mind is seen. Those three states of mind are reasoning self, emotional self, and wise self. Whenever there is an event, invariably you do reasoning, that is, logical thinking about an event. That is called as reasoning self. Of course, logical thinking, you consider the person is highly cognitively oriented. That is one. Second one is emotional self. Here, whenever there is an event, you have an emotional reaction, and this emotional reaction shuts your cognitive thinking and you get into trouble. That is emotional self. The third one is wise self. You're able to manage both logical thinking and emotional thinking effectively. That is wise self. Of course, you need to understand how the logical thinking works, emotional thinking, and wise self. For the wise self, the best example I can give you is tornado destruction. As you see a tornado, you're not going to enter into the tornado, you're just observe it. Here, if you get sucked into the tornado, that means emotional reasoning takes over, not the logical reasoning. You need to balance that. That is wise self. To improve that, one is impartial spectator. The second one is you have to improve your self talk. That means your judgment towards yourself should be positive. If you start thinking, I'm useless, I am bad, I'm a worthless fellow, I'm a useless fellow, that kind of talk will, or self talk or the judgment, will create trouble in the long run for yourself. Hence, you need to have a positive self talk. That is the important second point. Third one is focusing on the present moment. That is mindfulness. You need to balance the sleep. That means you should have a good sleep hygiene. You need to learn how to do stress management. You need to avoid alcohol, drugs, and other stimulants. Because whenever you are stressed, whenever the events are becoming difficult for you, if you learn coping by using substance, that means you are going to get into trouble in the long run. Exercise and relaxation helps in distress tolerance. In distress tolerance, you need to be aware of certain steps. Whenever there is a crisis or a distress, first and the foremost, you need to be aware there is a distress happening or a crisis is about to happen. Once you know that, start listing all the distress or crisis which has occurred in your life in the past 1 month or 1 year, like deliberate self harm you have done, suicidal attempts, how many times you have used drugs, how many times you had used gambling, threatening others, challenging behaviors others, shoplifting, binge eating, and so forth. These kinds of crises, if you have gone through, list all of them and start thinking what was my contribution in each of the situation. Here, you're not thinking about the others' contribution. You'll be thinking how much you contributed for this crisis. Here, in skills training, as I mentioned, it is skill training of the self. In the skill training, you will learn and empower by yourself. You are not going to change others' behavior here. That means, what is your contribution to the crisis you need to learn? Identify your problematic behavior and you need to work on that. That means, in distress tolerance, you need to analyze the situation, distress or crisis, look into the positive and negative aspect of this crisis, cost benefit analysis of the situation, and then you need to learn the technique of dealing with that. The best example is deliberate self harm after a fight with his partner. Imagine Mr. X has fight with his wife, Mrs. Y. Here, the Mr. X cut himself, telling that his wife is not giving any importance. As soon as he cut himself, his wife started giving attention. She took him to the hospital. He was admitted for 4 or 5 days. She started listening to him. Of course, in the short term, it is helpful for the Mr. X, but however, in the long run, it will be damaging to him. He got admitted to the hospital. He need to take leave. He has a scar on his hand now. At the same time, the wife will start moving away from that person. Although she is listening to him, she will distance herself by emotion. That means in the long run, it is problem. That is not the good way of coping. That is the best example I can give you at this point of time. Now, the client who has attempted a D such attempt should analyze what are the short-term benefit, long-term benefit, what are the short-term problem and the long-term problem. So that cost benefit analysis to be done, and he should decide what is best for me. For that, the best mnemonics which has been given for distress tolerance is resist. Whenever there is an event occurs and the crisis is there, you need to reframe the situation, reframe the event, engage mindfulness. That means there is an event which has occurred in front of you and it has triggered the emotions in your mind and thoughts. Now, immediately, you should understand there is a crisis is going to happen. Immediately, you switch on to mindfulness. Now, at the same time, you also need to do something for someone. That means if you are thinking about yourself and not doing anything to others, that means you are highly selfish. At the same time, you will not be able to do crisis tolerance. If you are able to help another person who is in distress, that means you have helped some person. That means you are a master. Your mastery is there. Then you will be able to implement here. The other important technique is intense sensation. That is either drinking hot coffee, or having the cold ice cream, gulping the ice cream, moving into the hot situation, or in a cold weather. That intense sensation brings down the distress very sharply. Shut it out. Whenever there is an intense emotion, anger is there, leave that place. Take time out. That is shut it down. Think neutral thoughts. If you are angry about a certain person, start thinking about what are his good positive behavior. How many people he has helped? How many people he is helping further? That thinking neutral thoughts helps, and sometimes taking a break. So these are the important skills one need to learn. Reframe. That means the event you have interpreted, start thinking about the alternatives and reframe the situation. Whenever there is an event and the crisis is about to happen, start doing mindfulness. Helping others helps you for distress tolerance. Engaging yourself in an intense sensation, hot or cold or exercise, that kind of things brings down the distress tolerance. Shut it out, moving away from that place. Thinking neutral thoughts, imagining good things, distress comes down. Now, suppose there is a distress tolerance skills need to be engaged. Coping ahead, that means imagine you are going to meet your boss. Of course, the boss may shout at you, and you anticipate there will be emotional turmoil. Whenever you are anticipating emotional turmoil with somebody or in some places, then you need to prepare yourself. You need to plan how to respond, how not to react to a situation. At the same time, having some controlling mechanisms. Somebody is there to help you and say, be calm. Or else, learn the dumping technique of removing your thoughts or removing your emotions and ignoring them. That is impartial spectator. Now, let's move into the another important distress tolerance. That is ABC analysis of the behavior. ABC analysis is a structured therapeutic approach that aim to increase the engagement in adaptive activities, decrease the engagement in activities that maintain psychopathology or abnormal behavior, solve the problem that limits the access to reward. That means you need to solve the problem, you need to decrease the distressful behavior, increase the behavior which will reward you. For example, if you are angry, frustrated, you will do deliberate self-harm, and then you get attention. But on cost benefit analysis, again you realize you have lost money by getting admitted into the hospital. Now, this is a vicious cycle of behavioral intervention. Here, you need to do intervention. Whenever there is an anger, you need to do anger management, maybe using reframe technique, mindfulness, intense sensations, or moving out of that situation. Further, if there is a deliberate self harm is going to happen, or you are doing this for an attention or to relieve your irritability or frustration, you need to move away all those deliberate self harm cutting tools away from you, or else engage in talking to somebody, or else use telephone counseling to call your primary therapist, or request your family members to be with you at that time. Finally, if you are able to move away from the DSH, now you need to engage in meaningful activity where you can improve the attention seeking behavior. That means you have a good coping skills. So everyone will start liking you. That means in turn, the attention increases and the cost of that is very less. This is how the behavioral intervention is done. So in behavioral intervention, you need to focus on hobbies, passion, pleasurable activities, the coping skills which are approved by the society, like reading, dancing, jogging, singing. Such behaviors will be admired by the society and you will feel that you are respected. At the same time, you also need to do activity scheduling, structuring of the day, and also learn social skills training. These will help you in distress tolerance or crisis management. Further, shaping healthy behavior, reward, token economy can be considered, persuasion or perseverance, documentation on daily basis of the activities. Do more of what matters to you, which you like, especially with regard to the coping skills which are approved by the society, which everybody likes it. Now, we will move into the emotional regulations. This is a very important component which need to be done in group skills training. Emotional regulation means it is the process of recognizing and controlling feelings or reactions to the feelings. In simple words, it is ability to manage your emotions response effectively. Here, you need to respond rather than react. This is the role of emotions. Role of emotions is survival. Whenever there is a threat or a stress, there will be fear so that you run away from that situation, so that the predator does not hunt you down, or else you'll fight, or else you will be frozen to the moment. That means emotions have survival objective. Not only that, emotions motivates to change. If you are happy, you will repeat that activities. That means that will improve your quality of life. That means emotions have motivational objective. Emotion helps in communication. If you are in happy, you will be talking to people. You will transmit happiness to everyone. That will improve the quality of life and also the communication. One need to understand there is a relationship between thoughts, feelings, physical symptoms, and behavior. Whenever your thoughts are positive, you will have a good feelings. Good feelings will be associated with good behavior and there will be less of physical symptoms. You will be energetic. However, the environment will trigger thoughts, feelings, behavior, and physical symptoms. And all of these are interrelated. Now let's understand how the emotions are triggered. There is an event. The event leads to an emotion. The best example is my boss yelled at me. When your boss has yelled, that means you will become angry or sad. But how does it come here? It is the interpretation of the event. The boss yelled at me, I am useless. Or else, how can he say to me? Initially, you will be angry at him. That is primary emotion. After some time, you realize you can't do anything to your boss. And then you get depressed. That is secondary emotion. You could not do anything, although you became angry. That will be the sadness. So, the interpretation of the event is very essential here. So, you need to teach the client the relationship between the behavior, emotions, thoughts, and sensation. How to teach that? Here, you'll be teaching in a 6 column or a 5 column chart. First column is time. What is the event? The event, whenever there is an event, what is the thought associated with that? What are the thoughts you got? What is the emotions you had? Rate the feeling. Feeling means 0. If you have a positive thought, positive emotion, it will be plus 10. If you are having a negative, it is a minus 10. It is a sliding scale rating. What are the sensation you have and what are the behaviors? Let me give an example. The boss yelled at you. The thoughts you get, he doesn't like me. He discriminates me. So that is the thought. You became angry or sad. That is minus 10. What were the sensation? You had palpitation. You had angriness. Your fist was tight that you wanted to hit him. The behavior will be shouting at him or shouting at other people or displacement. So this kind of charting, if you do over a period of time, that is thought diary, you'll be able to understand the relationship between thoughts, emotions, behavior, and sensation. It is a 5-column chart, thought diary. If you are able to do over a period of time, you'll be able to understand what is your thought processes, how the emotions are leading, and how the behaviors are there. So now, once you have understood, you need to learn regulating the painful emotions. To regulate that, first and the foremost, you need to learn mindfulness, being in the present moment. That is one, that is mindfulness. Second one is emotions are part of the life. That means today you are happy, tomorrow you may be sad, day after tomorrow you may be energetic, you may be irritated. That means accept these emotions. It is a part and parcel of life. That means it is a spectrum of emotions. One day you will have this, one day there will be another one. That means these emotions are not permanent. They are guest. They come and they go. So don't give any meaning to these emotions. Or that means you have to be non judgmental with these emotions. It is accepted to feel like this. It is accepted to have to become angry. Don't get carried away by the angry and do something else. That means non judgmental, accepting the emotions, and understanding these are not permanent, it will change. During this period, you need to understand about self validation. That means validation of client experience is essential with regard to emotions. Here, acknowledging the presence of emotion is the first thing. Yes, I'm feeling sad. That means you are able to acknowledge that I have sadness. That is identifying and labeling it. Now, allowing yourself to feel sad. That means, yes, it is right to feel sad, no problem. You accepted it, allowed, you have given permission to feel like that. And next one is understanding. So, these are the three important self validation. First is knowing that you are depressed. Second one is allowing to feel depressed, understanding why I felt depressed, and being non judgmental. So, these are the three important self validation you should understand. Now, these validating emotions, that is validation of client's experience. Here, not judging the emotions, not judging oneself for feeling that emotions and understanding that feeling. Here, you have labeled the emotion, you have accepted the emotion, and you have given permission to feel like that. For example, whenever you have an emotion of anger, the urge will be to attack the person who has done that or the event, that is attacking verbally or physically. Now, you learn to act opposite to that. That is, once you are anger, you should not attack. You should become more polite and civilized. That is, doing opposite. The second one, if you are sad, the urge will be to be isolate, withdrawn. Don't do that. Meet people and seek help. That is doing opposite. Anxiety. Anxiety means avoiding anxiety provoking situation. You don't want to go in a social situation because you feel anxious in a social situation. You need to do opposite now. You need to expose yourself to the social situation. That is acting opposite to the urges. To do this, you need to learn regulating emotions. For that, watch your emotion is the mnemonic. W means watch your emotion. A means avoid acting on those emotions. Think these emotions are temporary, they are not permanent. Learn and choose to experience those emotions. And think, helping to make this life colorful. That means these emotions are there to give color to your life, color to your emotions. That is what is watch. Now, moving to the last part of my skill transference, that is interpersonal skills. What is this interpersonal effective skills? Interpersonal skills involves the ability to communicate and build relationship with others. Interpersonal skills are the skills we use every day when we communicate and interact with other people, both individually and in groups. In simple words, these are used day in and day out. And if you are effectively able to communicate with individuals and group at large, that is interpersonal skills. Interpersonal skills effectively means doing what works. More than knowledge, it is the skill. You may know how to speak in public, but you don't have the skill. So, knowing is different, having skill is different. Further, generalization of the skill, that means using those skills where it is required is generalization of the skills. So, in DBT, interpersonal skills are classified into three important skills: core interpersonal skills, individual skills required to initiate, develop, and maintain relationship, and finally, walking the middle path. So, these are the three important interpersonal skills which need to be trained to the clients. So, let's discuss about this goals of interpersonal skills. That means, why should we learn this interpersonal skills? What should be the goal of these interpersonal skills? First and this foremost, be skillful in achieving the objectives with others. That means you need to have an objective for the interaction. That means interpersonal skills. Asking other to do certain things. You're requesting somebody to do something. That is interpersonal skills. Or else saying no to unwanted requests. That is assertively telling them. That is one. Building relationship, or else strengthening the current relationship, or ending the destructive ones. That is the second important goal. Third one is walking the middle path. That is, there will be a situation where you are asking help. At the same time, you may not be able to help somebody else who are making unwanted requests. Here, you are going to walk the middle path. But however, you need to know the factors interfering in interpersonal effectiveness. First and the foremost is lack of skills, especially interpersonal skills, is the first one. Poor motivation to learn the interpersonal skills. Emotional interference, that is emotional dysregulation. You become highly charged in certain situation. You will not be able to think. That is emotional interference. Indecisiveness, unable to take decision. Unclear objective. Whenever you are meeting certain people and discussing with him, you should know what is the reason for interaction. That interaction, you need to have the clear objective. If you don't have, then the interpersonal discussion becomes futile. Prioritizing the short term goals and long term goals. Further, environmental interference. Here, you may have certain goals to achieve, but your superior comes and says, don't do this, do certain other things. Or else, you may be forced to do certain things which you don't want to do. That is environmental interference. Interpersonal myths with regard to self esteem. I'm useless. I can't do this. I'm hopeless. I'm worthless. These kinds of interpersonal myth also will come in the way of factors interfering with your emotions. Interplay of all above factors also plays a role. So let's understand what are the potential goals in interpersonal effectiveness. That means, how do you look at these goals and achieve this interpersonal effectiveness? There are three important interpersonal effectiveness. What is the objective of this interaction? Whether it is to maintain the relationship or else form the relationship. Third one is maintaining the self respect. These are the three important interpersonal agenda you should have. Whenever you are going to interact with somebody, That means interpersonal skills. Think, why are we doing it? What is the objective of the interpersonal skills here? Whether is it relationship, whatever is the outcome, but the relationship should be maintained. That is the second one. Third one is no, I have to maintain my self-respect. Whether is the third. Now let's understand each one of them. The objective here is a good outcome. Whatever the interaction occurs, there may be shouting, whatever is the objective is good outcome. Then the interpersonal skills and interaction will revolve around the good outcome. That is first. For example, lady goes to a market. She will be engaging the seller or the owner of the shop by bargaining. During the bargaining, either the lady or that person may becoming angry. But at the same time, this lady is very clear. I need to buy this at 30% rate. Then the discussion goes on. And finally, she agrees to buy at the 45% discount. That means it is focused on outcome. Here, nothing to do with relationship or self-respect. The lady bargains to the extent the outcome is the goal. That is one. Second one, relationship. The objective is here to focus on interpersonal interaction, either to initiate the relationship, maintain the relationship, or improving the relationship. Irrespective of self-respect or objectives here, outcome, you want to maintain the relationship. That is the interaction. That means you will focus on how to please the person so that the relationship is maintained. That is the second one. Third one, self-respect. Here, whatever the interaction is there, it will be focused on assertiveness and make sure your self-respect is given here. That means, how do I feel after the interaction? If you feel good, that means you have achieved your goal. 2. Understand the first one. Objective. That means it is goal-oriented. Here, attaining the specific goal is the reason for interpersonal interaction. That means you need to do with certain targets. That is, dear man is the mnemonic. That means describe the situation. In that situation, what is happening? Express clearly what is your thoughts and emotion. Assert your wishes. Reinforce the behavior of the other person. At the same time, you will be focusing on the objective. Ignore the attack. Be mindful. The other person may attack you, but your objective is very clear. I need to buy this. I need to buy at 30% rate only. You need to appear confident. You should not feel threatened, show anger. You need to be engaging the person so that the outcome is in your favor or in your favor. Negotiate. So, this dear man is an important tool to achieve your goal by interpersonal interaction. Describing the situation, express clearly, assert wishes, reinforce, mindfulness, ignoring attacking, appear confident, and negotiate. Moving to the relationship effectiveness. Here the mnemonic is give. Here you want to maintain the relationship. So be gentle. You are not going to attack the other person. There will be no threat, no judging, no disrespect. Show your interest in the other person. That is very essential. Validate their thoughts, feelings, and behavior. And be easy manner. That is, be polite and be political even if you don't like them. That means here the relationship matters, not the outcome. That is the second. Third one is here your focus is on self-respect. The mnemonic is fast. Be fair. That means be fair to yourself. If somebody criticizes you, you need to be very clear and make your point. Don't apologize at any cost. Stick to your values. Be truthful. That will engage in self-respect. And please remember, never apologize if you are not at fault. Finally, in certain situation, you need to learn this stop technique. This technique works in all situations. Here, yes means stop. Whenever there is an event and your emotions are rising, don't act immediately. Stop. That is the first yes. Don't react. Be very clear about that. You need to be proactive. So just Freeze for a moment. Think. Take a deep breath. Don't react. Take a deep breath. Observe. Observe yourself. What I am thinking. What are my thoughts process? What is the emotions I'm feeling? What is my behavior is going to be? Observe yourself. Pull back. Look at the bigger picture. And finally, practice what is the best for the situation at this point of time. This stop technique will help you in instead of reacting, being responding to the situation. So this stop is very essential for the people who are emotionally dysregulated. Now, in certain situation, you need to end the relationship, especially in a toxic relationship. Here, you need to have a clear thinking. You need to have a wise mind. That means why you are ending the relationship, what are the pros and cons, benefit and analysis has to be done. And you need to do in a right frame of mind, not in a highly emotionally charged situation. Think positive and negative aspect of this relationship. End which are destructive. End those relationship which is impairing your quality of life. Or else, cost of living is greater than cost of staying in that relationship. Try to do problem solving. Cope ahead skills before you end the relationship. So those skills need to be used, and you need to do if possible in person. Coming to the validation. You need to validate experience, thoughts, emotions, and behaviors and actions of other person. Sometimes you need to do validation of yourself. That is compassion. Communicate the validation to other person. If that person is able to realize, yes, you have understood his experience, his thoughts, his emotions, that means that will improve the communication with them, improve the relationship, improves the problem solving. Invariably, invalidation hurts everyone. So, you need to validate rather than invalidate. What are those invalidation skills you need to know? Pay attention. Pay attention what they are saying. Be non-judgmental. Reflect back what they are saying. Rephrase it, paraphrase it, ask questions. Acknowledge the valid points. Read their body language. Empathize with their thoughts process, their situation and emotions. Show equality. That means I can also feel the same thing, or else I would have also done the same thing if in your place. So those kind of validation skill helps in interpersonal relationship. To conclude, my dear friends, apart from individual therapy, group skill training therapy is very essential in dialectic behavioral therapy. The skill training has four important components: mindfulness, emotional regulation, interpersonal skills, and crisis intervention or distress tolerance. And these intervention skills are done 6 months module twice in a year. That is dialectical behavioral therapy, my dear friends. Skills training team should not their limitation learn those training. They need to apply by themselves and teach the skill training to the clients. They need to know that the individual therapist is in charge and responsible for the client, not the skill training therapist. DBT is not complete without skill training. That you need to remember. Thank you very much for giving your valuable time. Stay safe.